A very good evening to you. You're with Channel I, and this is Ahmed. Another episode indeed, another day. And last week we did talk about several kinds of STDs and its related aspects. So today we're going to dive into a more specific disease, which is, you might know, and again, this might some might consider this as a taboo subject, HIV/AIDS. We're going to talk about that topic, and to talk about that topic we do have an expert with us in the studios, the consultant venereologist at the Sexual Health Clinic in Kalutara, Dr. Lasanthi Sirivatana, here with us. A pleasure having you here on the show, Doctor.
Good evening.
Good evening to you as well. Now, as you might know, or as you might not know, like the COVID pandemic in the current era, like we are having, we did used to have a 40-year pandemic which is related to HIV. So we can't forget about that. And to talk about that, we do have the expert here with us. Now, Doctor, if I shoot you the first question, what is basically AIDS? What's this, all this controversy? What is basically HIV/AIDS? How can you distinguish HIV/AIDS from other STDs?
So, HIV is a infection that is caused by a virus. So, in the 1980s, this too appeared as a cluster among men in America, and they had a very rare pneumonia and a very rare cancer. And when they studied these cluster of men who had this disease, what they found was something common to them, that they had immunosuppression. And then in a year later they discovered this virus, and since this virus was causing immune suppression in them, they named it as human immunodeficiency virus. And then they also found that this group of men who had this infection were all gay men, and therefore they discovered that this virus was transmitted sexually. So it was then identified as a sexually transmitted virus, and it was causing immune suppression, and therefore identified as human immunodeficiency virus. So HIV virus is a sexually transmitted virus causing immune deficiency. So when someone is infected with HIV, initial stages, you will have the infection and you will fight it with your immune system, and it affects your white blood cells, which is our immune system, and a particular cell called the CD4 cell gets affected. So after some time only, when the CD4 cell starts getting depleted in our body, and it comes to a very low level, that we find it very difficult to fight off infections that attack us. Then we say that we start to get opportunistic infections. Other infections, infections that cannot cause generally disease in people, will cause diseases in these people, and therefore we call that stage AIDS. AIDS, the 4 letters, stands for acquired immune deficiency syndrome, and that stage is the later stage of the HIV infection.
So it's basically the worsened situation of HIV.
Yes. So HIV infected person initially will be just called an HIV infected person, but when their immunity depletes and then they get opportunistic infections, then we call them AIDS patients.
And I know this is a sexually transmitted disease, but there has to be one or more ways where we could contract the virus, the human immunodeficiency virus.
Yes.
So what are these ways of contracting the virus?
Yes. So it is, again, as it's a sexually transmitted diseases, not only can it be sexually transmitted, it can be transmitted from mother to child. So if a pregnant woman has this infection, it can be transmitted from the mother to the baby while the baby is in the uterus, or when the baby is being delivered during partus, that is, or through breast milk. and also it can be transmitted from infected blood. So, how this can occur is generally now, because it does not transmit through blood and blood products if sterile procedures happen in the health sector. What generally happens for an infection to occur is during unsterile procedures, like when people who inject drugs use unsterile equipment, the infection can go within a group of people. Or during tattooing, if you use unsterile equipment, infection can go between two people. So, those are the occasions when infected blood transmission can occur.
So again, we have to be very mindful when we are in those situations. Like you said, when you get a tattoo, you definitely, you're not thinking, oh, I might get an STI, I might get AIDS. You're just in the moment, you tend to forget.
Yeah, I think in tattoo parlors and all, they generally use sterile things, but you know, like in prison settings and places like that, they do use unsterile equipment.
Places under low hygiene.
Yeah.
So now, actually, if we could talk about the local statistics about HIV and AIDS, you know, the local data that we have available about HIV and AIDS, if you could talk about
the local data. Yes. So we have about 4,142 patients diagnosed since 1987. That was when we first identified our first case of HIV. And our new infections are less than 200 per year, but we do diagnose about 450 patients per year. New infections are patients who have acquired the infection very recently, but we can diagnose patients for a year who may have had the disease about 10 years ago even, because this is a chronic infection. So also we have about 94 mother to child transmissions in the country. And also if we look at how these transmissions have occurred, majority of the acquisitions are through men having sex with men recently. So
you mean same-sex relationships?
Yeah, generally it is through male sex, because females the risk is less.
Yeah.
And so if we look at male to female ratio, there are about 4.5 men infected to 1 female. So those are the data we have for the country. But if you look at 2020 data for the world, there are about 37 million people infected with HIV or living with HIV, and we have about 1.6 new diagnoses that year.
So that number itself proves that we can't actually forget about the disease. It's still prevalent in the world. And doctor, that we discussed this before the program, you said that you have a specific website to actually get this information and to do much more about this. If you could talk about that.
Yes. So I work for the National STD AIDS Control Program, and in the we have our own website for the National STD AIDS Control Program, and we have our own data regarding HIV and sexually transmitted infections in the website. And if anybody is interested on further looking into it, they may go into that website, and we have all the data for the past several years, because we have a special unit called the Strategic Information Management Unit, and they maintain all the data related to HIV and STIs in the country.
Okay, and now you did mention that we did receive the certificate, which is a certificate for eliminating syphilis and HIV from mother to child transmission. That we did get the certificate, we did achieve that certificate given to us by the WHO. So what was the procedure like? What was the process of getting there? What was, if you could explain how we achieved this milestone?
Yeah, so as I told earlier, one of the ways of transmission is from mother to child, HIV, and also syphilis can be transmitted from mother to child. So Sri Lanka has been testing pregnant women for syphilis since 1952, and we have been testing pregnant women for HIV since 2016 universally. So when a woman is pregnant, we offer them the syphilis and the HIV test, and we since syphilis is a bacterial infection, once we diagnose that a pregnant woman is infected with syphilis, we can treat them for syphilis and cure them completely. And if we diagnose a pregnant woman with HIV in pregnancy, then we can give them antiretroviral treatment and reduce their viral load to an undetectable level, and then thereby reduce the risk of mother to child transmission and prevent baby getting HIV. So since we've started this program, we have been able to save all babies who were pregnant, mothers who had HIV, getting HIV.
So the success rate is 100%, you would say?
Yeah, so generally if a pregnant woman is infected with HIV, if we do not do anything, there is a 40% risk of baby getting HIV, and if the mother breastfeeds the child also. But if we diagnose the mother and put her on antiretroviral therapy and do all the necessary other steps to prevent mother to child transmission, then we can bring that risk down to less than 1%. And thereby there may be, we can't say always 100% in medicine, and therefore we can reduce that risk and to such a low level, and we have done that, and thereby we applied to the WHO to, in 2019 to say that Sri Lanka had achieved the indicators necessary to say that we have eliminated mother to child transmission of HIV and syphilis, and WHO did a vigorous assessment of the country's program and said that we have done that, and it's not an easy task. Having achieved that certificate, we need to sustain it. So we have to do a lot of work to sustain that status now.
I think they giving you their appreciation, that the WHO giving their appreciation, and we also give our appreciation to you for actually getting to that milestone, because it's very important for us to achieve anything, any positive thing in the field of medicine. It's actually good for humanity. So now I want to ask you about, I know the answer to this question, but I want to get your opinion. Is there still stigma related or associated with HIV and AIDS?
There is. We do work on it as much as we can. Maybe it is less than it used to be, but there still is. That stigma is, there could be self-stigma within the person once they get diagnosed with HIV, and there could be stigma from the outside for the person. So what we see is stigma happens because there is fear for the disease. So what we try to do is try to educate people about HIV and try to get people knowledgeable about what HIV is, that it is no longer a deadly disease, that methods of HIV transmission, methods of HIV non-transmission. People are worried if they see a person with HIV that they might get HIV. How can you get HIV if you know that it cannot be transmitted just by talking to that person, just by hugging that person?
It's basically not like the COVID-19 virus.
No, it is not. So thereby, so we have to reduce, so awareness is the most important thing that we need to do to reduce stigma and discrimination.
And Doctor, I think that's a very big misconception that the society has, the stigma related to HIV and AIDS. Now, if you could talk about the other common misconceptions or the myths in the HIV disease.
Yeah, so as I told you, the main thing is the belief that HIV is deadly. HIV is no longer deadly. It was deadly in the 1980s. Now it is not, because there is treatment for it, not to cure it, but to control it.
That's
now,
a very, very good point to emphasize on. It's not curable, but it's controllable. So don't think that you don't have a way out. It's still controllable.
Yes, at the moment it's controllable. Research is going on for a cure, but right now it is controllable. It has become a chronic disease like diabetes, like hypertension. There are treatment which you have to take for the rest of your life. So there is antiretroviral treatment available even in Sri Lanka, which is given to you once again free of charge. Very expensive medicine given to you free of charge. You need to take it every day for the rest of your life. Say if you are diagnosed at the age of 20, you need to take it till you're 80 or 85, because you won't die of HIV if you take your medicine every day as told, but you would die of something else. So it is no longer deadly. That is one conception, that you don't have to be worried about HIV, and it is not transmitted by everyday day-to-day contact or social interactions. It is transmitted through sex, it is transmitted through mother to child, it is transmitted through infected blood. As long as you don't have any of those contacts, you can have any interaction with the person with HIV. Then it is there is a misconception that HIV infected woman cannot have a healthy baby. Now we have proven that, we have eliminated that HIV infected women can have healthy babies. And there is a myth that the HIV infected people can't have sexual relationships. As long as they are on medication and their viral load is controlled, they can have sexual relationships. So those misconceptions no longer have to be there, because it's a chronic disease. They are living a normal lifespan, normal life.
I think this, I think this is a very good opportunity to inform the public as well, that they do not have to fear.
They do not have to fear, and nor should they stigmatize or deprive the right of people who are infected to all this that they can get by stigmatizing and marginalizing them and preventing them access to medication, preventing them from going to the doctor for the rest of the life. They need to go there. Unless we give them an enabling environment to go there and get their medicine, they wouldn't go. Then they would not be controlled. Then HIV would be within the society.
Yeah. Now, doctor, you mentioned that the patient has to take medicine every day for the rest of their life. So one might think, questions might pop up in their mind, that are there any side effects of these treatments or the medicines? Are there?
There used to be initially, when in 1985 the first HIV medication came. In 95 we developed it into the highly active antiretroviral treatment, but along the years the medicine has become better and better and better. We have developed fixed drug combinations where 2 or 3 drugs have been put into one pill and made into one pill, so they don't have to swallow multiple pills, and the side effect profiles have become lesser and lesser and lesser. But one thing you have to keep in mind is, when they take these medicines, they have to adhere to the schedule. Unless they adhere to it, they will develop resistance, and if they do develop resistance, we will run out of options. So that's something that they have to keep in mind.
Okay. And if someone, doctor, needs to get themselves tested for HIV, say for example they actually they think or they suspect that they have an HIV or STD in general, how do they do it?
Yes, so getting tested for HIV is very easy in Sri Lanka. Once again, all these tests are done in the sexual health clinics in Sri Lanka, maintaining their privacy and confidentiality always, and so they can walk into any sexual health clinic and get themselves tested if they think they have been at risk of acquiring HIV. And also we have this rapid test. Sometimes we do outreach programs where we have mobile clinics, and we do rapid finger prick tests. So if they happen to be in a place where we do those tests, then it's a finger prick, especially for World AIDS Day. It's just a finger prick test. And also now we have this special home test, the HIV saliva test, where you can do it yourself. And this is called the HIV self-test. And it can be like you can get it through calling our hotline, which is on our website, or there is a Facebook page for the National STD AIDS Control Program. You can go through that and request a self-test, or we have this special app called Know For Sure. On that app, you can log into that app and you can even assess your risk of having HIV.
If you could yeah, look at the screen, I think it's being displayed on the screen right now.
Oh, that's great. So on that app, you can assess your risk of HIV and then order a self-test. If you are in Colombo, you are lucky, it probably gets delivered to you. But if you are someone in Kalusara or any other district, you probably has to come to the clinic, because we don't have the
necessary means
to deliver it to your home as always. But you can come and walk out, get it from our dispensary and walk out. It doesn't take that long. And the self-test kit, and you can do it at home. So it saves you the time of waiting. And also from that website, you can even book in your visit to the HIV test. Whereas if you walk into a clinic, you have to wait your turn probably. But if you go through the Know For Sure, you can book your slot. And in a busy people can book their slot and then just walk in for their test.
That's actually really great, the use of modern technology and developing those kinds of websites in order to the betterment of the public. And Doctor, if you could quickly, because we have come towards the latter part of the program, if you could quickly explain how can you prevent yourselves from getting AIDS?
Yes, HIV.
HIV.
Yes, let's. So HIV acquisition, you have to again ABC matters. That is abstinence, be faithful, mutually faithful, and correct and consistent condom use. So those three you have to practice to prevent HIV acquisition as well. But apart from that, there are other ways that if you have been exposed to HIV, if you think you've had the risk of being exposed to HIV, within 72 hours, if you have been sexually exposed to HIV, if you think you've had sex with someone who has HIV and you get to know it within 72 hours, then you can come to one of the sexual health clinics in Sri Lanka, and we can assess that risk and see whether that exposure is risky enough, and we can give post-exposure prophylaxis. That is, we give antiretroviral therapy for 1 month to reduce the risk of getting HIV through that HIV exposure, and that is called post-exposure prophylaxis. Then for individuals who have a very high risk of getting HIV, who do not use C of our previous methods of prevention, that is not using condoms, they can have pre-exposure prophylaxis. That is to take HIV treatment throughout the month to prevent acquisition, or they can have something called event-driven HIV medication as and when required to prevent HIV acquisition. So those are some other ways where we do practice, give patients those options as and when necessary in Sri Lanka.
I think that was some good ways to prevent HIV, not AIDS, HIV, because AIDS is the complication that comes along with HIV. Yes. So Doctor, with that we have to wind up today's segment of iMed. Thank you so much for being here, because we did discuss a lot about STDs, coming from STDs, and the complication or the specific disease of HIV and AIDS. So thank you so much for being here with us. We did have with us the consultant venereologist at the Sexual Health Clinic in Kalutara Dr. Lasanthi Sirivardhana here with us in the studio. And thank you so much for being here.
Thank you, my pleasure.
And with that, we wind up today's segment of iMed. Thank you so much for joining in. Keep tuned into Channel I and join us next week as well for a different disease on a different day. With that, I'm saying bye. Have a pleasant day ahead.